Hi, I'm Nina Clooney, the Assistant Director of the Institute of Neurosciences, Mental Health and Addiction at the Canadian Institutes of Health Research. I'll be presenting an update on CIHR's Integrated Cannabis Research Strategy for the 2021 Michael G. de Groot Centre for Medicinal Cannabis Research Conference. With legalisation and regulation of cannabis for non-medical use approved in Canada in October 2018, stakeholders called for support for new research initiatives and evidence-based approaches to federal activities. CIHR led the development of the Innovative and Collaborative Integrated Cannabis Research Strategy, or ICRS, to support the advancement and translation of scientific knowledge on cannabis in Canada. The objectives of the ICRS are to provide evidence to meet stakeholder needs, to help inform evidence-based policy and practice decision-making, to ensure data and information sharing through open science practices, and to facilitate pan-Canadian collaborations across national stakeholders. The overarching vision of the ICRS is that a well-coordinated series of activities can position Canada to be a world leader in developing the cannabis capacity and amassing the research evidence needed to appropriately roll out policy and regulatory models for non-medical cannabis use. The ICRS supports parallel streams of research, understanding harms and medical benefit. And underlying these streams are research activities which will serve to synthesize, standardize and increase access to evidence. This is particularly relevant for federal, provincial and territorial policymakers, service providers and other knowledge users, as well as clinical researchers. The research activities also serve to fill evidence gaps in specific target areas, and the activities here will allow for multi-year research efforts and also provide flexibility for rapid response initiatives to provide timely evidence for emerging priority areas. The ICRS was designed in such a way that each funding opportunity and the evidence generated through the funding opportunity builds upon the last and ensures that the research that is being funded is where the need lies. This iterative, bidirectional process focuses around the cycle of identifying knowledge gaps, developing and launching strategic funding opportunities, and facilitations of knowledge mobilization. CIHR has forged a number of partnerships for the ICRS. We partner with the Canadian Centre on Substance Use and Addiction, CCSA, and the Mental Health Commission of Canada, MHCC, on multiple funding opportunities and knowledge mobilisation activities. We've also partnered with some health charities, and it won't be a surprise that those which we have formed partnerships with are related to the areas where there has been shown to be therapeutic benefit for cannabis. So the Arthritis Society of Canada, the Canadian Cancer Society and the Multiple Sclerosis Society of Canada. We've also partnered with Veterans Affairs Canada. There are 6 CIHR institutes partnered in the strategy, the Institutes of Cancer Research, Circulatory and Respiratory Health and Human Development, Child and Youth Health, as well as the Institutes of Indigenous Peoples Health and Musculoskeletal Health and Arthritis. And these partnerships represent an investment of over $36 million over 9 years. So far, we've launched 3 short-term, 1-year funding opportunities, and they laid the foundation for 2 multi-year funding opportunities whose funding started last year. So I'll first discuss the short-term funding opportunities that were launched at the beginning of the ICRS. In 2018, through the Population Health Intervention Research on the Legalisation and Regulation of Cannabis in Canada grants, CIHR funded 14 projects to generate data and evidence to monitor and evaluate the potential benefits, harms and unintended consequences of legalisation. These projects aim to build the evidence base to support cannabis-related policy and programme development. And supported research included projects on data infrastructure, impaired driving, pregnancy, childhood and youth health, prevention, patterns of use, workplace health and safety, and impacts of policy changes on different populations, including Indigenous populations. In 2019, CIHR, the Canadian Centre on Substance Use and Addiction, and the Mental Health Commission of Canada funded 26 projects through the Cannabis Research in Urgent Priority Areas Catalyst grants. These one-year grants supported research to investigate the potential benefits and harms of cannabis use, focusing on urgent priority areas that were previously identified through stakeholder meetings and a knowledge gaps workshop. The projects pertain to research areas such as the investigation of the effects of cannabis use on mental health, neurodevelopment, pain management, as well as research on the prevention, harm reduction and treatment of problematic use of cannabis. Emerging evidence from the projects supported by the Population Health Intervention Research on Legalization of Cannabis grants, presented at the end of grant workshop in 2019, indicated an urgent need for more data on the risks of cannabis use during pregnancy and breastfeeding, cannabis use in youth populations, cannabis use in driving, and cannabis use in the workplace. Emerging evidence from the projects supported by the Cannabis Research in Urgent Priority Areas grants, which were presented at an end of grant workshop in 2020, suggests that cannabis use in pregnancy may have long-term adverse implications, and that there were sex differences observed in this study. Also suggest there is a need to study the risks of secondhand smoke or vape exposure in children. In older adults, cannabis may help to manage symptoms of certain medical conditions, but the benefit to risk ratio is unclear. There's also more evidence needed on the health effects of medical and non-medical cannabis use in older adults. I'll now move on to talk about more recently funded grants. So firstly, the Teen Grants Cannabis Research in Priority Areas funded 14 5-year grants starting in 2020. Projects are focused in 9 research areas, and $19.3 million was invested by CIHR, the Arthritis Society of Canada, Canadian Cancer Society, the MS Society of Canada, MHCC, and Veterans Affairs Canada. To try and encourage collaboration between the teams, a virtual meeting was held soon after the funding started to introduce the teams to each other and to discuss potential areas of collaboration. The projects funded by the Cannabis Research in Priority Area Team Grants are investigating the medical benefits of cannabis use, include cannabis-based precision medicine for osteoarthritis therapy, cannabis to manage symptoms in children with cancer, cannabis as a therapy for spasticity and multiple sclerosis. Also being investigated are the therapeutic effects of cannabidiol in autism spectrum disorder and in anxiety. The use of cannabis for chronic pain and cannabidiol for acute pain is being investigated. And one project is investigating the effects of cannabis on sleep and sleep-disordered breathing. Under these teen grants, there are also projects being funded that are investigating harm reduction of cannabis use, and those relate to cannabis use and the impact on lung health, cannabis use on Indigenous peoples' oral health, the impact of cannabis use on mental health, including in psychosis, adolescent exposure and brain development, and forensic mental health patient populations. There's also projects investigating the impact of cannabis use in pregnancy and on developmental outcomes in children. The federal government enacted the Cannabis Act, but it's the provinces and territories who are responsible for developing cannabis policies in their jurisdictions. The Partnerships for Cannabis Policy Evaluation Team Grants was developed by CCSA and CIHR to support projects that would produce research evidence to inform current and future cannabis policy at both the provincial and territorial level. The grants support research to evaluate and monitor both the implementation and impact of cannabis-related policies so that the best practices can be identified from both public health and public safety perspectives. Evidence from these projects may feed into the legislative review of the Cannabis Act. And the teams are developing cross-jurisdictional collaborations to maximise data collection and knowledge exchange, resulting in the ability for comparisons across provinces to be made. Ultimately, the aim is that this Partnerships for Cannabis Policy Evaluation Programme will provide robust, coordinated evaluation that is required to monitor the health impacts of cannabis policies, both positive and negative, so that policies could be adapted in near real time in order to maximise the benefits and minimise the harms for Canadians from any province or territory. These 3-year projects began in early 2020 and are evaluating policies relating to driving and traffic safety, workplace cannabis use, cannabis retail stores and product labelling, public education campaigns, healthcare and treatment system utilisation, and youth. The legalisation of cannabis has provided a much needed opportunity to better understand the relationship between cannabis and mental health in Canada. There are pronounced gaps in knowledge concerning the negative impacts of cannabis use on mental health outcomes and the potential therapeutic benefits of cannabis and cannabinoids, the influence of mental health problems and illnesses on patterns of cannabis use, and the experiences and needs of diverse populations who live with cannabis use disorder and/or a mental illness. The purpose of the Cannabis and Mental Health Funding Opportunity Grants is to strengthen the evidence base and expand cannabis research related to mental health, to build cannabis-related research capacity, and to inform the development of future large-scale research projects. In 2021, 18 projects were funded by MHCC, the Canadian Consortium for Early Intervention in Psychosis, the Schizophrenia Society of Canada Foundation, and Veterans Affairs Canada. And these projects have lived experience perspectives meaningfully included in all stages of research, including the research design, execution, knowledge translation and dissemination, and the evaluation. And there are projects being supported to investigate cannabis and mental health in priority populations, focusing on people who use cannabis and are living with mental illness. And the priority populations, some examples include youth, LGBTQ2S+, and people living with substance use. There are also projects being supported to investigate First Nations, Inuit and Métis peoples' approaches to cannabis and mental health, cannabis use and the mental health of veterans, cannabis use and psychosis in adult populations, and also cannabis use and early phase psychosis. And finally, knowledge mobilisation of emerging evidence is a major component of the integrated cannabis research strategy, and we carry that out through a number of mechanisms. The knowledge exchange workshops provide the opportunity for researchers from funded projects as well as stakeholders to come together to share data, discuss results and provide context of project findings. They're an integral part of the ICRS. And we've already held 2 such events. The Population Health Intervention Research on Legalisation of Cannabis End of Grant Workshop was held in June 2019. And the Cannabis in Urgent Priority Areas End of Grant Workshop was hosted in November 2020. What We Heard reports and other knowledge mobilisation products are developed after the workshops, and annual knowledge exchange events have been planned for emerging research data to be presented from the Partnerships for Cannabis Policy Evaluation Grants and the Cannabis Research in Priority Areas Team Grants. Over the last 3 years under the Integrated Cannabis Research Strategy, we've launched 5 funding opportunities and held 2 end-of-grant knowledge mobilisation events, with more knowledge mobilisation events to come in the future. Thank you for your attention.